So if you ask who's running up these tabs, it's everybody. If you go to a hospital, hospitals are no longer what they used to be. They're now hospital systems, and they're gigantic. And they because it consists of hundreds of hospitals belonging to the system, 200 hospitals in a system, and the big hospitals gobble up the small hospitals. And the small hospitals are typically the ones around them in their vicinity, in their what they call market. And that converts the small hospital into part of the system. And then when the big hospital lawyers begin to negotiate for rates with the insurance companies, they include these smaller hospitals, which were cheap. And they make them pay the same rates as the big hospitals, which are expensive. So that drives the prices up.
Wow.
So all these hospitals are just gobbling like Pac-Man, and they're getting bigger and bigger and bigger and more powerful. So it's big hospital is one of the major villains of this. And they're untouchable because they're so powerful with their billions and billions of dollars.
Hey everyone, and welcome. I am Morgan Giss McDonald, founder and CEO of Paper Raven Books, and I have with us today the author of a book that is relaunching. The book is titled Ripped Off, Overtested, Overtreated, and Overcharged, the American Healthcare Mess. It is more relevant today than it ever has been, and I am so glad that you are here with us. Author, Dr. Gilbert Simon. Thanks for being here, Dr. Gil.
Thank you, Morgan. It's my pleasure.
This book has not only did it get initial massive praise, especially from people who know healthcare, but we're seeing people come back to it again and again and say, holy smokes, Dr. Gill, you really called to our attention something that has become more important than ever. And I'd love for us to just dig straight into it. This is about our healthcare, right? And the cost of healthcare. I mean, are our healthcare prices too high? Are we paying too much? I mean, what's your perspective on this healthcare system we've got going on?
They're out of control. Our healthcare prices were high when I began to research this book. They got high during the COVID pandemic, and they're high today. They're currently consuming about 19% of our total gross domestic product. Nobody else is close. We are the highest pricing system in the world. And you'd think that would be good if we were getting the best care in the world, but we're not. So we have very low value in our healthcare system.
18 to 90% of our entire GDP. So all the money that our country makes, almost 20% of it is wrapped up in the healthcare system.
Right. It used to be below 10%. So what happened? How did it get to be so high? And if we don't stop it, it's going to get even higher, because healthcare costs have been growing at a faster rate than our gross domestic product has been growing. So every year we take a bigger and bigger chunk out of that GDP.
Gosh, it's no wonder. I mean, you hear the stories all the time of someone who had to file bankruptcy because of healthcare charges, or you go in to, for what you think is a simple ER, visit, and it ends up being 10 times more. I mean, that just happened to me. I took a kid in to get an elbow x-ray and they're trying to charge me $2,000. And I'm like, it was an elbow x-ray. And so it's a little personal note, but you do hear anecdotes like that. I mean, why do we have these high prices? Like, not that we need to point fingers exactly, but we need to find the root of the cause. In your research, what did you find?
I could point fingers, but everyone is to blame. The consumer is to be blamed, because the consumer has no concept of how much money they're spending and costing. But the big villains here are the big corporations who have taken over healthcare system. Once upon a time, there was just the doctor, the patient, the drugstore, and each person did their best to be economic and to not overutilize. And then came another person called the third person, and that's the insurance company, or in this case, or Medicare or Medicaid, who picked up the tab. So somebody else picking up the tab, and one person consuming goods, another person providing services, neither one paying for it. Clearly, the costs keep going up. So that's That was the fundamental error that we made. We went in the wrong direction.
Yeah.
So now we're paying for it.
So is it just that we are consuming more services, like we are maybe going in when we don't need to go into a doctor or an urgent care or an ER? Or is it also that when we go in, that particular service is inflated somehow?
Both.
Both. Okay.
Both, to a very great degree. The doctor who overdoes, overtests, overtreats is in large part responsible. And if you ask him why he does that, he'll say, "I'm afraid I'll be sued if I don't." So the fear of medical malpractice suits is what drives a lot of doctors into overutilizing.
Wow.
But when doctors get surveyed themselves, roughly 25% will admit to over testing. Another 20% will admit to over treating. Another 10% will admit to doing more procedures than necessary. So we know we're overdoing, and then we're overcharging to a great extent. But it's not the doctor who's overcharging. It's not the pharmacy who's overcharging. It's who the doctor works for who's overcharging.
Who do they work for?
Hospitals. 70% of all doctors work for hospitals.
Wow.
The days where the doctor hung out a shingle and worked for himself, was independent, and had complete autonomy, those days are rapidly coming to an end and will soon be over.
Is it because it's dangerous for you to operate as an individual? Is it better to be sheltered by a bureaucracy or an institution?
No, it's become too expensive.
Oh.
Every doctor now has to have an electronic medical assistant in place. He has to have an information technology expert fixing things and setting things up. He has to have a biller to do the billing for him, because billing used to be, here's your bill. and the patient would walk out the door and pay the bill. Now, there is no bill. The bill gets sent to the payer. The payer is somewhere far, far away who has no concept of what just went on, but you have to bill for that.
Yeah.
So there are billers. There was a time when doctors didn't have billers in their offices because patients paid the bills. Now there's 0.7 billers per doctor.
What?
Yes. Yes. In a doctor's office of 10 doctors, there'll be 7 people doing the billing for that person.
That's incredible.
Yes. Well, the bills get sent out, and it's not really a bill, it's a claim. They've changed the name. Bills get paid. Claims don't get paid. Claims get adjudicated. They've even stolen the language. Claims get adjudicated, and 1/8 of them get adjudicated negatively. No, I'm not going to pay this claim. So then you got to resubmit the claim. You have to appeal the claim, and of those, 4/5 get approved. So it's a cat and mouse game, and the third party payer doesn't want to pay, and the biller wants to get the claim adjudicated favorably. So it's extremely complicated and very, very costly. So if you ask who's running up these tabs, it's everybody. If you go to a hospital, hospitals are no longer what they used to be. They're now hospital systems, and they're gigantic. And they consist of hundreds of hospitals belonging to the system, 200 hospitals in a system. And the big hospitals gobble up the small hospitals. And the small hospitals are typically the ones around them in their vicinity, in their what they call market. And that converts the small hospital into part of the system. And then when the big hospital lawyers begin to negotiate for rates with the insurance companies, they include these smaller hospitals, which were cheap. And they make them pay the same rates as the big hospitals, which are expensive. So that drives the prices up.
Wow.
So all these hospitals are just gobbling like Pac-Man, and they're getting bigger and bigger and bigger and more powerful. So it's big hospital is one of the major villains of this. And they're untouchable because they're so powerful with their billions and billions of dollars.
Well, folks, if y'all are watching, listening with us, and you're thinking, I have experienced this, I've experienced the runaround with insurance claims and paying way more than I intended to, or even, thought possible for some medical procedure of any kind. Go ahead and go to paperravenbooks.com/ripped off. You can get a free copy of Dr. Gill's book. Really, we're just trying to get the more and more of the word out, because this whole discussion around the American healthcare system is only becoming more and more important. I mean, as you're saying, Dr. Gill, as these hospitals are continuing to grow bigger and bigger, the insurance companies are growing bigger and bigger. We are almost wanting to become more dependent on them. I think we need to take a step back and say, whoa, like, what are we really volunteering ourselves into? So make sure to grab a free copy of the book. We linked it up next to this video. And Dr. Gill, I mean, you came at this because of experience, right? You're a doctor, right? Like, what's your personal background in the medical field?
Well, I began a very long time ago. I began back in the early 70s in practicing. And that time, doctors were still autonomous. We could still choose where we wanted to practice, who we wanted to hire, and how much we wanted to charge. Mm. And now all that's been taken away. It's now part of the hospital systems that own the doctors, and there's been this insidious takeover of healthcare from what was once a very esteemed and very respected profession into an industry, a medical industrial complex, now bigger than most other complexes. One person in 8 in this country works for that complex.
1 in 8 people work for
healthcare system,
the broader healthcare system.
Right, and most of them are not making you better. They're not there to improve your health. They're there to push paper.
Yep.
And and that's what we become. Very complicated. And why is it so complicated? Well, for one, we have 1,500 health insurance companies in this country. Mm. Each one has their own system of contracting, paying, and networking with doctors. That's another thing that's new, the network. If you're in the network, you got to see a doctor in the network, because that network doctor has agreed to receive a certain payment from the insurer. Mm. See a doctor out of the network, you're really on your own. Wow. Because that doctor can charge you anything he wants to charge you.
Wow. And he knows it, because he'll know whether he's in your insurance network or not.
Right. I mean, I've done that. I'm also a patient at times. And when I went to a hospital and for x-rays, I went to the wrong hospital. And they said, you're not, this is not your network for your x-ray. I said, what will it cost me for this x-ray? They had no idea.
Yeah.
And I saw the technician, what will it cost? I have no idea. What will the doctor say? I have no idea. No one has any idea. The only one who has an idea is the company that owns the x-ray and owns the hospital. They have the idea. And what do they charge? As much as they can. Mm-hmm. Because there's nothing stopping them.
Yeah. Well, how do we start to unwind this? Is there a way to unwind this?
There is a way, and it's going to take a lot of effort. We're trying. We're moving towards a tipping point. This year, California attempted to enact a bill to create a single payer system in California. It got past the committee and it didn't get into the assembly. So, but it got more votes than before. So just like legalizing marijuana and legalizing same-sex marriages and giving women the right to vote, these are all obvious things that have to be done. It takes time to get a significant critical mass to overcome the resistance. Mm-hmm. And so we're inching towards that direction. But every day that goes by, it's getting worse.
Yeah. What is the single payer system that California is working on?
Well, the California state itself, the state would become the payer. So the state would collect taxes. The state would recoup the money that goes out to pay for Medicare and Medicaid. All the money would come into one payer, the state itself.
Hmm.
They would pay all the bills.
Hmm.
Every doctor working in California would be part of the California Care Network. So if we don't know out of network, all of the insurance companies go away. All the
Oh,
co-payments go away. All the deductibles go away.
interesting.
It's just tax. But if you take all that money, all that taxable money to support the system, it adds up to less than we're currently paying.
Wow.
So that's the obvious factor, but people are reluctant to give up what they have,
Hmm.
even when they know what they have is awful and driving them crazy.
Yeah. I mean, it's sort of like holding your breath and hoping you don't need any medical attention for the rest of your life. And it's like, well, it's probably not true. We probably are going to need more and more medical attention as we get older. And I mean, we just saw COVID come through, and one virus, toppled the whole thing.
Right. So we keep asking people, are you happy with the current healthcare system? And they say, no, it costs too much. It costs it's sky high. Even though they're not paying the bulk of their premium, and their employer is,
Mm-hmm.
they're paying for all the co-payments, and they're paying for their portion of the premium, and they're paying their deductible. And just last week there was a survey that was done where it was shown that 20% of everybody in this country, who were surveyed, said they were struggling to pay their bills.
Mm.
And that was across the board. If you're low income, it's much higher struggle. And that same group said that they wished that healthcare costs came down, and the desire was stronger than the desire to improve public education, the desire to improve climate change, the desire to fix race relations. That was the number one concern, was how can we get healthcare costs down?
Yeah.
And it means bucking powerful interests, and the interests are getting more powerful every day.
Yeah. Dr. Gill, what's your hope for the reader? So whoever's with us now, I mean, you're probably resonating with this message. Maybe it's your own experience or someone else's experience, or just reading the dang newspaper. You might be feeling like, yes, there is a problem with the healthcare system. Maybe you want to check out this book while it's free. You can grab Dr. Gill's book, paperhavenbooks.com/ripped off, all one word. But I'm curious, Dr. Gill, like what do you want the reader to really know and feel empowered to do?
Well, the reader has to know that when Medicare and Medicaid spend tons of money, it's their money they're spending, because they're spending taxpayer money. So it's not somebody else's money, it's their money. And when a CEO of a company gets paid $26 to $45 million a year as an annual compensation package, it's their money that they're getting. They need to know that they are personally funding this slow motion robbery, and it's coming out of their pockets. And at some point, if we do nothing about it, it's estimated that down the road, half of our income will go to paying our healthcare bills. So it's time for a revolution. It's time to really, we can't just nibble away at the edges. It's time to just dig it up, throw it out, start all over again. Or look at what Europe has done. They're doing so much better than we are. Their outcomes are better than ours. Their costs are better than ours. All we have to do is just look across the ocean and see how others are doing it. And we're not number one in this game. We're not even number 10, we're number 50 in most regards. Cuba, which spends less than $1,000 a year per capita on their healthcare, has a better infant mortality rate than we do. Cuba has a better life expectancy than we do. They're spending $800 a year per person. We're spending $12,000 a year per person. We're spending $1,400 a year just on prescriptions. That's more than some countries spend in total.
Wow.
So that's another huge area that needs to be addressed: the high price of prescription drugs. And since I researched the book and wrote the book, there have been attempts to control prescription prices, all without any success at all. We've gained nothing except higher prices. Just last month, and I say last month, just January, this is the beginning of February, just in 1 month, 450 prescription medications had their prices increased by up to 9%. So while we're clamoring to lower the prices are continuing to get out of control. Why are they so high? You hear them say, we need that money so we can be innovative.
Mm-hmm.
Another grandmother's tale. The money doesn't go for innovation. The money goes for sales and marketing,
Mm-hmm.
staggering compensation packages,
Mm-hmm.
and to gobble up more the pharmaceutical companies. So the innovation is not really to create new medications. That's done. No question, it's done. But it's not done by big pharma. It's done by little pharma. It's done in hospitals, in university laboratories, the NIH, taxpayer-funded research. That's called early stage development.
Mm.
Taxpayers pay for that. Then when it seems to be promising, big pharma steps in, acquires the patent, and then does late stage development. And that's mainly marketing and sales. So the innovation has been done before. There's one company that had no research and development department. They didn't even bother with research and development. They just bought existing medications and sold them.
Wow.
They were the darling of the industry.
Mm.
So that's another major area that needs a lot of work, and it's going to require overcoming the power of the industry and overcoming all of the lobbying that's being done by the industry. They released 1,400 lobbyists on Congress this past year. That's 3 per congressman. Congressman can't keep up with this. Congressman doesn't know enough to argue back with lobbyists who are really taught what to say.
Yeah.
So that needs to stop. We need to stop the lobbying, and in my opinion, we need to vote out those congressmen who succumb to the pressure of lobbyists.
Yeah.
So we're unique in that regard.
Yeah. Well, I mean, and I think it's up to us to find good sources of research and information and really think about these questions, because I mean, if not for our generation, the next generation, like when is it going to get fixed or uprooted and replaced with something else? You know, this is not something that we can just sit on and hope that it takes care of itself. You know, it's what you're describing is a self-sustaining system where hospitals and lobbyists and pharma and insurance all have this momentum for bigger and more expensive. And I mean, heck, when you think about how many people is employed by the system, how much of the GDP is consumed by the system, we're going to definitely have to do something before it runs everything into the ground. And so this is kind of our wake up call, I feel like.
It should be. It should be. We've had wake up calls in the past. The turn of last century, we spent 25% of our income on food.
Mm-hmm.
Food was very expensive. Milk and eggs took a big part of our income. The agricultural industry redesigned itself, reformatted itself, and brought the food prices down to an affordable level for the most part. Healthcare has to do the same thing. It's time for a redo, a makeover. Because right now, healthcare costs are now second in household budgets, exceeding food.
And we eat food every day.
I know. No, but it's relatively affordable. Healthcare is becoming unaffordable.
Yeah.
We have a lot of medical debt in this country.
Mm-hmm.
That's something new, medical debt. No, other countries don't have medical debt. We have medical debt. And the debtor did not do anything wrong. He didn't go to a casino and blow his salary. He was just walking to work one day and a piano fell on his head. It wasn't his fault. He ended up in the hospital with $1 million bill. So, and the insurance company paid a big part of it, but he was left with a huge amount to pay. So medical debt is also eating us alive.
Mm-hmm.
And the debtors are not irresponsible people. They're just unlucky people. For the most part, they're college educated, married, above the age 50, and they're just stuck with a bill they can't pay. So we need to be woken up, and every day the powers that have controlled the industry are getting stronger and stronger and stronger. Pushback is getting stronger and stronger. So at some point, there'll be a tipping point. I was told in medical school that the tipping point would come when the healthcare costs were so great that everybody had to chip in and pay their portion, and it came out of their salary. And every year they would meet with their employer and be told, we're reducing your salary this year by this amount. We're reducing your salary. And everybody would say, my salary goes up every year. Where's my annual increase? Where's my bonus? Where's my increase? No, healthcare costs are taking away your increase. You're now getting a decrease. And at that point, everyone would say, hey, what happened? It's a wake-up call.
Where's the money going?
Yes.
Yeah.
Well, we haven't had a wake-up call yet.
Yeah.
And the day of reckoning is coming.
It is.
So that's the point of this book. Let everyone know they're being robbed. They're being robbed, and they need to know they're being robbed, who's doing the robbing, and what they have to do about it.
Yeah, folks, it is time. We've been talking about the American healthcare system for a long time. Dr. Gill, thank you for writing this book and for giving us the specifics to go into, to start to really understand the interworkings of how this system has set itself up to become self-perpetuating, to become self-growing in this way. And it really comes down to us to learn what's happening, to discover what's happening, and to say, wait, no, we actually don't want this to be embedded in our country and our children's, the country that we're passing on to our children and our grandchildren. This has got to change. So thank you for writing this book.
Let's hope it changes.
Yeah. Yeah. All right, folks, if you feel like this is your wake-up call and you want to share with other people, something substantial, some real research from a medical doctor, please share this with them. Tag them in this video, send them the link. It's paperravenbooks.com/ripped-off, all one word. We'll link it up next to this video too. And spread the word, because now's the time, folks. Now's the time. Thank you, Dr. Gill, for being here with us.
Okay. Thank you, Morgan. I appreciate being here.
Of course. And we'll see you guys next time.
Okay.
Bye.
Bye.